So hello everyone. Welcome to the webinar, Action on Health Equity Through Early Childhood Development Programs, Measurement and Policy. I'm Diane Oiko. I'm with the National Collaborating Center for Determinants of Health, and I'm in beautiful Antigonish, Nova Scotia. We had a snowstorm yesterday, and we have a beautiful spring day today. So the saying in Nova Scotia is wait 10 minutes and your season will change. I do want to remind everyone that the call is being recorded, and we will be posting it on our YouTube channel for viewing and listening and use later on. It will be up within in the next couple of weeks. You're hearing my voice, Diane on the left. Also on the line is our Knowledge Translation Coordinator, Asher Cortete. She's working from her home in Montreal, and I really want to thank her for all of her work. She's managing the technological strings, has managed the setup and to make sure that everything runs smoothly, and without her we could not do this successfully. And please use the chat box to put any questions, comments, share resources, keep introducing yourself. If you are in a group of people, please write in here how many you're with. If there's more, group meaning anything more than one. We like to keep a good tab on how many people we have that have actually joined us, and it helps us to keep track of our numbers a lot better. So thank you in advance for that. As you know, we are one of 6 national collaborating centers for public health spread across the country. You can go to the website NCCDH to learn more about the 6 NCCs, and as I had said, we're NCC for Determinants of Health. And before I go any further, I want to most importantly acknowledge that the NCCDH is located in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. We are hosted by St. Francis Xavier University, which is located in Mi'kmaq territory. It's become very common to see a lot of these land acknowledgements done during events. This is something the NCCDH is doing now consistently in any presentations as well as any written products that we produce. And it may seem very common, but it's actually really, really important to do in a meaningful way. And because our staff work nationally, and because our audience is national and international in some cases, I extend my respect and my thanks to all First Nations, Inuit, and Métis communities across the country in all provinces and territories, and we're very grateful to be here. Thank you. And as you know, this is who we are. You can learn more about us at our website, nccdh.ca. And certainly do get in touch with any questions, comments, or information you may need. We have 4 main objectives for the webinar today, and we're asking that you consider these carefully when you fill out the evaluation at the end of the webinar. If you need to leave early, please go in and fill out the evaluation. It will literally take you less than 2 minutes, and we've designed the content around these objectives. We really do use the feedback to plan future webinars, but also to plan our work plan in coming years. So it's very useful for us to have your feedback, and we want to know if we've met the objectives that you're expecting us to meet. And we have 3 speakers today. So with that, I'm going to do an introduction of our speakers and pass it over and get right to the content. So Marni Brownell is a professor in Department of Community Health Sciences at University of Manitoba. She's Senior Research Scientist and Associate Director of Research at Manitoba Center for Health Policy. And Marni has a focus in using administrative health and social services databases to examine child health and well-being. She has a particular focus on the social influence and socio-environmental determinants of health. She currently is leading a project focusing on First Nations and Métis child health and development, the health and well-being of children in the child welfare and justice systems, and evaluating programs that are designed to improve child development, family functioning, and health equity. And she'll be presenting some of those results today. Her co-presenter and partner is Mariette Chartier, and she's an assistant professor at the Department of Community Health Sciences at U of M. and Senior Research Scientist with the Manitoba Center for Health Policy. Her main interests are in the area of child health from a life course approach and population health perspective. She's currently involved in research projects which use de-identified administrative data to design population-based interventions and increase our understanding of what child health is. She also works closely with First Nations partners, and right now she's preparing a report on the health of First Nations children, looking at the indicators of their medical conditions, mental health and illness, education outcomes, justice system involvement, social services use, and there's real intersections of all of those factors. And she also recently led a provincial report on the mental health of children in Manitoba, so she has lots of expertise in the mental health field. And once Mariette and Marni are finished speaking, I will transition to let Pippa Rowcliffe start. I'll introduce her now, though. So Pippa has a degree in politics, philosophy, economics, and a master's degree in international development. She has specialization in rural development planning, and she's UK-born and Canadian by choice, I think I've heard her say, and she has worked in corporate sector, government, nonprofit sector, and since 2008, she's worked for the Human Early Learning Partnership at University of British Columbia. She was executive director of the Council for Early Child Development that was founded by Fraser Muster, who most of us on the line will have heard of. And then she was Knowledge Translation Director, and since 2015 has been the Deputy Director. She has particular interest in social justice and equity, specifically how we use data and knowledge to build system of leadership and address equity, improved outcomes, and how does that inform policy development. So we have a real diverse group of speakers on today, and I'm really thankful that they could all join us. So with that, I'm going to hand the speaking mic over to Marni and Mariette.